Hi, I'm Natasha. I'm the massage therapist for the Center for New Medicine and the Cancer Center for Healing. So there's a few questions that came in as to what I do here. So the types of massage that I do are deep tissue, lymphatic, Swedish, trigger point, and anything to do with, and Reiki, and anything to do with aches and pains. So we'll start with Reiki because Reiki is for everybody, and anybody and everybody can do it, and it's energy work. So basically our body is made of energy, and what this does is it's almost, some of it is hands-off and some of it is hands-on, but it's centering your energy and stabilizing your energy and balancing everything. So basically it's good for aches and pains, it's great for anxiety, depression, ADD, OCD, any kind of a racing mind or any kind of problems. It basically centers you and calms you and balances everything in the body and takes away aches and pains. So our body is completely made of energy, and that's what Reiki does, is it's good for everybody across the board. So next we're going to go into lymphatic, and lymphatic is mostly done on the center cancer side, and it's amazing for anybody with an immune disorder or where their immune system is being compromised. So it's amazing for cancer patients, Lyme patients, lupus, autoimmune disease, anybody that's going through a detox, or anybody pre and post surgery, because it's amazing for swelling. So with lymphatic, what I do is I go in and I'm feeling for any kind of swollen lymph nodes. The lymph system likes a very light touch. So it's all superficial, it's underneath the skin, on top of the muscle, and it's basically moving the fluid. So all the fluid in our body, lymph-wise, is all of our blood and lymph fluid. And our lymph nodes are what filters all of that. And what this does, the lymphatic massage, is we're moving the lymph system because it doesn't have its own pumping mechanism. And with feeling for lymph nodes, we want to move those lymph nodes. We want to get them down if there's anything swollen. So lymph nodes can be the size of a pea, they can be the size of an almond. They can also just be a grainy feeling underneath like sand underneath the skin. That typically is a struggling lymph system that it's working really hard for you. So basically what I do is I go in and I feel everything that's going on in the body, and I work in areas that are struggling. So if anybody's had any kind of lymph nodes removed, that's great for any of those people, because the other lymph nodes are working harder to take place for the lymph nodes that were removed. Sometimes when people have lymph nodes removed, it creates swelling. So this is amazing to get rid of any kind of lymphedema, any kind of swelling in the body. So, and I also use the hemosonic machine, and the hemosonic machine increases the lymph system 40–50% more than regular lymphatic massage. So what the hemosonic machine does is I start out my massage with the hemosonic machine, and it has red lasers and green lasers. The red lasers move lymph and the green lasers move blood. And it has a sonar noise to it that travels through water. Since we're made of water and fluid, the sonar noise helps push the fluid through those lymph nodes. And it has a little thumping to it as well, the machine. And the thumping is amazing for stimulating the lymph nodes. So I really love the hemosonic machine because it does wonders. It's really helped people tremendously. And with the massage, after using the machine, I go in behind the machine and do the massage, which is extremely beneficial. Yes, it's pre and post surgery for anybody with an autoimmune disease, anybody with their immune system being compromised. The cancer, when people get cancer, the lymph system becomes very sluggish, like mucus. So what we want to do is keep the lymph moving. And since it doesn't have its own pumping mechanism, this is the way to do it. You can also walk, you can also use the rebounder, and you can also use dry brushing, which I brought a dry brush right here, and it's very light. Everything goes towards the heart. So this goes down, the arms go in towards the heart, and you can go clockwise on the stomach and the legs go up. Everything goes towards the heart. And it's extremely beneficial for anybody who wants to detox as well. So what else do we have? We also have deep tissue that I do. Deep tissue is amazing for anybody with a lot of stress, a lot of tight knots that you can get from sitting at a computer. Most people carry a lot of stress in their neck and shoulders or in their low back. And deep tissue, I go in with my hands and with my forearms to get the maximum amount of pressure. So it's really designed for somebody who can take pressure, and it's designed for breaking up those tight muscles and releasing all the toxins and getting rid of that lactic acid in the body. And of course, with all massage, you drink lots of water afterwards. So that gets rid of a lot of the stress in the body with the tight muscles from people that work hard at their jobs or they work out really hard. It's great to get rid of all that stress. And then trigger point I use also, it's a little bit deep, and I use that, I can add trigger point to any of the massages to just go in if there's a particular knot and you don't want deep tissue throughout the body. It's great to just work out that one particular knot, and then we can add that to any massage. And then you're not stuck with doing deep tissue through the entire massage. We can also do that with Reiki. If you're not sure if you want an entire hour of Reiki, I can save 10 or 15 minutes towards the end of each massage if you give me a heads up, and I can add a little bit of Reiki towards the end of each massage just so you can get an idea of what it feels like and what it's about and if you like it or not. Okay, and so last but not least, we have Swedish, and Swedish is more relaxing. It's very beneficial for the muscles. It's very beneficial for the circulation system. Pretty much all massage is great for the circulatory system, and it's just a lighter touch for those people who don't like the deep stuff but still want the benefit of being effective towards the muscles. So I think
you do the pregnancy.
Oh yes, the pregnancy. Yes, I do pregnancy. So pregnancy is done after the first trimester. You don't want to do pregnancy massage during the first trimester. We want the baby to get stable in its environment, and you can start pregnancy massage in the second trimester on through the actual delivery day. And as it gets closer to the due date, usually moms are in a lot of pain in their low back, so it's really beneficial for them to have some stress relieved off their low back. And sometimes they get sciatic in their glutes, so it's great to get some of that stuff worked out so they don't have to deal with the pain of the extra pressure of the baby on the body. And we can also hit some trigger points as you get close to that due date, where we can try to induce that labor, which is always beneficial in case that baby's not ready to come out. So those are the types of massage I do here, and I hope you guys book an appointment with me, and feel free to call and get in as soon as possible. Thank you. My name is Natasha.